Good afternoon, everybody. Wanted to go back and do a COVID-19 addendum. After I recorded last time, we had some major changes. And so I wanted to do those updates and do some clarifications of some things that changed. I also tried to put new noise or new directives in red to try to help you decipher what's going on. And I also want to remind you that the CDC, the national pressure on the CDC is way ahead of where Colorado is. And so that's why you're seeing this double messaging coming out. So we're still under November 2020 public health orders. It's been amended 5 times. They were renewed. I don't know if they're going to be renewed again, but the main concepts again is mask and appropriate eye protection when it is appropriate. They continue the 6-foot social distancing, continue gowning when you're doing direct patient care, gloves in the appropriate places for the appropriate reason, training for isolation and infection control techniques, and good documentation. Okay. So a new directive that came out on March the 2nd was more guidance, and an FAQ sheet came out, and it's about 5 pages. It's pretty decent, but the big message on the FAQ was don't let your guard down, don't change things, that you do have to follow all the directives, including essential visitors, and developing an indoor plan. Okay. So the crisis standards, as I said, were updated a little bit on March the 2nd. And they took away National Guard to be helping us with staffing, which I was totally not in favor of. And we tried to advocate to hold off until April because we knew that we've got outbreaks, and we knew that we had staff with outbreaks, and that we still did not have a good pool of temporary workers. One of the things that the Department of Employment is doing right now is they are taking the gig workers that have applied for unemployment and looking at their skill sets. And they really are encouraging our industry to start using gig working concepts to help us fill our gaps in care in our facilities. If you go to that form, you can get notifications on what's going on. There's quite a few boxes you can look at and decide what you'd like to hear and follow, and you will get an email when they make updates. Okay. So the new indoor visit guidelines that were up on the 10th is that we have to be below 10%, all but one county in the whole state's below 10%. So we're good to go on that. The goal is to have 70% of your vaccinations completed. We are good on that as well. And we're almost 2 weeks out on the whole state having that 2-week after period. What we're running is only about 60% of our staff. I was just at a meeting about an hour ago, and there's a lot of talk about how we're going to get our staff rate up because we don't want them to be super spreaders. Visitors have to make an appointment. They have to wash or disinfect their hands. They have to agree to the rules. One of the things I've worked with a lot of facilities is we have a little agreement form. They sign it every time they come in. And the reason that we did that is when you put your name on an agreement form, it's more embedded. And then if they violate it and or cause any problems for you, you have legal recourse that you might need to use. So again, it works. It helps the state know that you're doing due diligence. It helps the visitors know, and this is regular visitors, not your essential visitors. But you still have to check in everybody that comes in the facility. So take their temperature, log them in, have them sign in, sign out, fill out the little form that we've been dealing with for months, and make sure that you keep that up. Keep those in a locked cabinet. We had a facility that one of the staff members took all of the forms and disappeared with them. So we have no proof in the pudding for the facility for 3 months. And the staff person quit, and that was her revenge to take all those forms. We're still working on that legally. Okay. If you have a COVID outbreak, I pray to God you don't. CDPHE wants you to have a private room sick room for that client, and not to send them anyplace because Medicaid doesn't want to pay those bills at a receiving site. So if they can be ambulatory and managed, in a room. That's what they would like us to do. So you're going to hear more about that towards the end. This next meeting is coming up at the end of the month. And then I recommend, this is my own personal recommendation, you take the infection control tool that we filled out from the department about a year ago, and let's revise that baby, update it, and have it current for 21 for your 21 notebook. So compassionate visits are one of three. We have hospice and palliative care, one adult, one at a time, and they can give a hug. CDC overrode Colorado on that, said that they can have a hug. The visitor needs to have glove and mask on. Again, we prefer them not to be, clown in bed with them or other things. But and we have seen other things, but to giving a hug is okay. Two, if you have depressed clients or isolated residents that have decompensated and are medically compromised, you might want to have a family visitor, again, no kids, 30 to 45 minutes max, and to perk it up, because visiting through the window seems to be not an acceptable tool anymore. And then three, if you have a memory care and you have somebody that's lost weight or not eating or needs more help to eat and drink, you could have a family member, if they know safely how to help that person. So that was specifically for memory cares in nursing homes. So vaccines and testing. So MACO has been really stepping up. They're doing well. They even helped us during the snow disaster earlier this week in the rural areas. They made another run, didn't complain about it. So MACO has gone out of their way to be a great partner. I have not heard a single complaint since they've come on board. Testing is very reliable. They're at 97.6% reliability, which is fabulous. It's better than what the state was doing themselves. And so if you're not using MACO, you are responsible to report the test results, and that's where you report them. So again, we're doing good with facility vaccination. Staff is slowly complying, and we're breaking down the barriers. That is going to be a big push between now and April to get high vaccination rates into our employees. And then the other thing is that we know for some of you that have larger facilities and might have some administrative staff, we now need to get them vaccinated as well. So if you get stuck trying to get a vaccination, some of the things that could work is the pharmacy that you're doing long-term care may be able to do it. County health departments in the small communities have been fabulous, and they've been able to help. And then county visiting nurses have also been helpful in the smaller communities. The COVID-19 update is a daily experience. I help seniors periodically get signed up. Some days you can go on the main website and you can do a bunch at once, and others you got to go and piecemeal it. What the strike team said, if you can't figure it out from using one of these entities, to please email them and they will help you. And this could be a new resident because you're past your 3 times that the pharmacy is coming out to your facility, or new employees that you need to get vaccinated. And again, remember that vaccinations cost nothing. There's still some insurance companies and entities trying to charge an administrative fee. And every time I hear that, I report them to Colorado, and all of a sudden they're backing off again. They are very worried that the government's not going to give them their administrative fee dollars. So the testing did change, and this was the directive from the 2nd. So any resident leaving the facility, if they go to church, if they go out with their family for a few hours, they go out to dinner, they go to medical appointments, x-rays, they go back into your weekly testing cycle, and at least twice. And we may get more directives towards the end of the month on that. If you have an employee or a resident convert to COVID, you do not have to do testing for 90 days from the 14th day of diagnosis. So again, they don't want to do repeat, though I think they're going to change their mind, because what they found in the college world at CU and CSU and Pueblo South and Colorado Springs is that even though people had COVID and had supposedly cleared and had antigens, all of a sudden they're having a secondary breakout. So I think the rules may change again. And when I give the COVID update for April, I'll let you know if that happens. If you have anybody, if 10% of the county turns positive, you're back to twice a week. And your county health department should be sending you a directive. I believe the directives are going through the portal and email if you signed up with an email address. So I wanted to show you what's actually growing in Colorado. So this is a picture of the London variant. What I want you to notice is the ends. So in the general COVID, they're called spikes. These are called horns. And the horns are suction cups, literally, and they suck out the nutrition and the minerals they need to stay alive out of good cells. And so this is the variant there. The thing that has happened in Europe, Italy shut down 100% yesterday. Germany is down to bare bones again, and France. And so they're back into a major cycle, and we're very concerned because we have it in Colorado. The big problem is that the general lab processes weren't prepared to check every COVID test to see if it was a variant. And that has, they're working on some correction, but notice the horns in this one. This is another picture of it. You'll also notice not only does it have horns, it has spikes. And so this is a baby cell, and it has a lot of energy and a lot of ability to cause destruction to good cells. This is the African variant. And you'll notice in this that the spikes are what they call weaves. So they have more than one spike in the center. So in the normal COVID, it would be one green spike and they would be kind of evenly distributed. Here, it's a different kind of distribution. So you'll see little baby ones and all the way to super mature ones. But then you also see as they mature, what I call the flower or the horn. And then the horn starts developing spikes. And so the African variant, we have had in southern Colorado, we had some workers brought in at the private prison system from the south part of the country, and they brought the variant with them, and God knows why they didn't test them. But at any rate, we've had an outbreak. It has not hit the community level that I am aware of, but as of the 9th of March, this was being seen in the private prison systems down in the southern part of the state. So it looks very, very different than the other two variants. And our bodies, I don't know, they're, last thing I read about a week ago, that this particular variant likes A positive and A negative blood types, which is very prevalent in Africa, where in the US we have more O than we do A or AB. So data, we're still having about 1,000 new cases a day. The cool thing is we're not swiping up hospital beds, and the death rate is really slowed down. And so everybody's hanging their hat on that. I'm hoping that we can continue that. We're still over 6,000 deaths for the last 12 months. And it's about 1 out of every 8 Colorados. We've had a death rate, and about 1 out of every 8 Colorados have had COVID at one level or another. You might have seen the news the last few days. Several people have left hospitals that have been there for months. Like one guy was there for 5 months. One lady was there for 3 months. One doctor passed away this week who had been working ICU COVID and was in his early 40s. So as I said, the state's still being very conservative. But the cool thing is that they have put a tremendous amount of resources, energy, time, and people into the pop-up vac clinics. So the new one that's happening, the new ones that are actually going to evolve this coming weekend for the next few weeks will be in big areas like event centers and soccer fields and Coors fields and those types of things. So we're going to see more of that. And then there is some work being done to try to figure out more home visits or try to figure out how we can take more pop-up small vaccination programs to different neighborhoods, especially those that are lower income and transportation. They may only have one car for a family and they're unable to get to an event. So the small group gatherings have been kind of ignored. Spring break is here again. It's how we got in trouble last year. A lot of noise going on about getting in trouble again this year, though Florida keeps touting how incredibly cool they are. they still have the highest death rate in the country. And then California, New Jersey, and New York. So like I said, you haven't convinced me that small groups is a good way to go. So at this time, do not plan to take your residents to any small group activities in the community. So in the last 60 days, we've had 822 people catch COVID twice. And then we've had some reports where people became sick post-COVID and tested positive. We had a report yesterday that a newborn had antigens for COVID with a mom who had tested positive but never was sick in the early part of her pregnancy. So I think we're going to learn more and more as this continues to go. We also have to deal with the people's belief system that when they took a flu shot, they got the flu. They really never got it. They got what we're dealing with COVID vaccines right now, is that your body's got to build a new defense mechanism. And so what the goal is, or the hope is, that people that are having some pretty miserable responses, and even when their lymph nodes swell or they develop a fever as a response from the thymus or whatever's going on, that next year they won't have as big of a response. We do know for sure that they're already building the booster shots to start in the fall for the senior market. So there's some employee management guidelines that if you need help with Department of Labor, I was with one facility, we had a discussion with Department of Labor trying to figure out if you had to pay 14 days of off time because they were exposed to somebody with COVID in their household or in the community. And basically the Department of Labor wouldn't take a solid stance, but they said you should follow best practices, and that they still would actually go after facilities who are refusing to follow the guidelines. So part of the guidelines says if you're under 500 employees, you don't have the support of emergency staffing, you still have to pay overtime. So I put the rules up here, and I'll tell you, I'm the last person to have these clear in my head because I keep looking at them, trying to understand. I like them simple and mapped, and it's all legalese and lawyer driven. But that's the website if you got to figure that out. And you can call unemployment at that phone number that I posted. So some things to do for the business is one, I'm really encouraging you to go back in your 20, get all that organized, filed, bring forward anything that you need to for 21, and then and make sure you have an updated census form. And in the materials that Maria is going to post for this, I will put the census form and the slide deck. I've really changed how you do a census form. It will keep you out of a lot of problems if you had to evacuate for like weather that we had last weekend, or state shows up or OSHA shows up. That census form already has had visitors to it and had positive feedback. All right, so do not drop your mask, okay? And you do need to wear goggles if you're doing personal care, any skin care, any bladder care, any stool care. Make sure you're putting your eye protection on. So masks are a must, gloves are a must, 6 foot social distancing is a must. There's a lot of noise going on. Can we cut it down to 3? Nobody's willing to put that out there, even though there's been some studies saying that 3's enough in kids. Nobody's willing to take that in the senior market. If you have a really sick client or they're in isolation for 14 days, you do have to do full PPE when they're in their room. And like I said, be very careful because we've already had facilities put all their stuff away, and that will get a fine. And the fines, again, are sitting between $500 and $2,000. So where are we? Well, 1, have your master sheet. 2, keep up your EM resource. 3, review your outdoor protocols. Make sure that you're happy with them. Do you need to make any improvement for safe visits? 4, you really encourage your staff. One of the cool things, I went to a meeting at Relias yesterday that I got invited to, much to my surprise. They have a great program, and I will also be talking about that and send you, if you're interested. It's with Relias. A lot of you are Relias clients, but it talks about the emotional impact that COVID has made on all of us, and how to develop language and response systems, not only for the residents, the families, and the staff, but for each other as administrators. So I really like it, and I was really impressed with the thought that they did that with that. And I think it helps with some language to talk to families about, because they're in burnout. They're also in disbelief that this stuff is still going on. They also believe that if they had the vaccine, that they now are safe. And unfortunately, the media has perpetuated that, showing pictures of grandparents going and seeing their grandkids the next day after the vaccine. The vaccine isn't even activated in their body hardly. So again, the media has not helped with that noise. But we are, and let them know, and please send out your weekly letters and updates that you're working on it. You're letting them know when the indoor visits can start, the rules of engagement, and that and keep them really upbeat. The more you talk to them, and the more you tell that it's coming, and you're 90% ready to roll, or or you will be able to roll by middle of April, because you'll have all your staff and residents up to date. That encourages them, and then they don't call the health department or your local health department or your county commissioners or city council. I've heard from all of them across the state that why are you not doing visits? So we have another potential issue in your life. It's called OSHA, and they are safety net for all industries across the state and the labor force. They have been making some random inspections. Some of it's just a phone call. Others, they have actually done on-site visits. We've had a couple of problems where they made a phone call. The staff thought they were joke or fake calls, and did not relay the information to the administrator. And so had to do a bunch of apologizing and appeasing. They'll have a form that you have to fill out. It's really not hard. If you've got EM resource and all the rest of the stuff done, it's actually fairly easy. And then you send in your documentations for isolation, your training logs and competencies, your resident communications. And so all the stuff you send staff, all the stuff you send your residents, they want copies of it. They want to know what you're doing and how you're protecting the safety of your residents and your staff. So OSHA, please do not ignore them. They have fining power. So our new project, indoor. All right. So again, we have to have a good track record, and we have rules about how many people can be reporting to be COVID positive and all that other stuff. Very hard to keep your head around. Just basically look at the color on the COVID map, and you should be blue. Blue or totally ready to go. We're getting a new COVID map at the end of the month. Be interesting to see what they do with that. And then if there's outbreaks in the community, you may get an email from the local health department saying that indoor visits are suspended. Please follow that and keep that email in your COVID notebook, and then make sure you have enough supplies. So in the decision tree, the 5 criteria is 1, basically be blue. Number 2, have an indoor visit plan. Number 3, have all your staff and residents educated. Number 4, have all of your supplies that you need, including your testing cycles for every week and those results, your gloves, your protective mask. And it might be a good time again to ask our quilting partners in the state to make cloth masks, and then they can wear a paper mask and then a cloth mask over it. Especially because we don't know what these variants are going to do, and I don't want any family member to have an outbreak. Ventilation, this has probably drove me more crazy than anything, trying to figure out an affordable ventilation system. So I looked at what the schools were doing. I was looking at what the private schools were doing, what the daycares were doing, doctors' offices. I looked around all over the place, and there's some pretty expensive ones. And then we found one that is affordable. And so it's an air cleaner with an HVAC specifically approved by EPA. So if you cannot ventilate the visitation room, then you can look at this one and see if you can afford it. Otherwise, you got to figure out some sort of ventilation. Now, Eileen is under the impression that ventilation is not a priority, but I haven't seen it taken out of the equation yet. All right, so step 1, do not let people all over your building. Keep your visits in one local area. Remember that one of the rules is that you have to have staff be able to do oversight or a trained visitor. If you have a big enough facility and you have a visitor that knows you and that will follow the rules, you should think about that, because you can have volunteers now helping you again. All right, as long as you followed all the steps, okay? And then the part is you really need to explain, and that's why I like that letter that they sign, and explaining why we're asking them to cooperate. And so that they just don't go running in the building and take over your building. And we've had that happen since January, where visitors was under the impression that it was all over and they could do what they wanted to. So they have asked, the state has asked that please share your indoor visit policy with your local health department. And then you will, if you have a breakout, you must suspend, and you have to follow best practices, okay? Well, the other thing that happened in the last 2 weeks, I've had conversations with the 2 liability companies for our state, and they're not on the same page. And so your liability insurance could be denied if you are not following guidelines specifically and staying within the parameters. And they will be looking at claims, and they will be asking for all the documentation. And if it's not there, they're not going to be there for you, and they can cancel your insurance. You cannot renew your license without liability insurance in place. So again, this is a real big must. The second big must that I have not put on here that I didn't think about till just now is we got some new fire volume in the new fire and safety for the state, some new rules about residents' abilities to evacuate and make and understanding directions. And so I'm working on that as well. And once I get some clarity on that and some stuff I've heard in the community, I'll probably do another one of these tapings. So step 2 is your talking points. Again, I put them in all in one place for you. I've talked about all of it. And the hug is okay, but to sit there and hold hands and be touchy-feely is not okay. So yes, you may have a hug. Please continue your plexiglass barriers. You need that 6 foot. And they may bring something outside for eating and drinking to share with a family member. That's perfectly okay. But again, you have to have the barriers, so you can't have them sitting shoulder to shoulder and sharing a meal or sharing drinks, okay? And then my suggestion is that you should have 0 outbreaks if you're a small home. If you are a larger home and you have a COVID area and it's already deemed as a COVID area, then you can adjust your practice based off of that. But if you are the typical, the 600 and some small homes we have in our state, I doubt if hardly any of you have a COVID area. Okay. Step 3, make sure you've got your visitation documentation log for everybody, essential visitors, doctors, hospice, lab, whoever's coming in. We had a situation where a doctor told a facility he didn't need to sign in or be checked in. And we let him know clearly he does have to sign in and be checked in. So hopefully that pushback from him will go away. If you have an outbreak, they will look at all your visitation logs and everybody that was in the facility at that time and moment, and probably a couple hours before, a couple hours after, and they will be doing contact tracing. And this is, again, this is how they're figuring out how these variants are going to work. So we're going to be in this for quite some time. We're about, I think we were 21% yesterday vaccinated with both shots. And we've got to hit minimum of 50, but preferably 70 to get herd immunity. And so the Moderna is starting the kid trials, and we'll see how that goes. And then we'll see, there's another vaccination coming into Colorado. It's going through the last stages of emergency approval. I think it's geared for high school students, but I'm not 100% sure. I believe for our market, we'll be sticking with Moderna and Pfizer for the most part. And then staff also will have the option of J&J. I do not know if J&J is going to be approved for long-term care facilities. I haven't heard that yet. All right, so I've had a bunch of people ask me, well, how do you write a policy? So one of the future discussion points, I will be talking about how do you write a policy. And so I just wanted to give you the list of things that are normally the parts of a policy and what you should have in it. Do not think you have to write a book or you have to be a lawyer to write a policy. The best policies are simple language, clear and distinct, and it's better to have a lot of policies than one policy trying to cover a lot of things. It's one of the problems we've had with COVID is that they tried to make documents that are ridiculously long and hard to follow. All right, and then your contract for the visit should have these parts, and you should be keep making sure that you have in clear print the name of the visitor and how to contact them, your declaration signature, the date and time they came, when they left, and then who did they go to, and that they did the agreement. Okay. All right, education. So again, coming back around to your 2021 education modalities, you need to do some renewed education. You need to make sure everybody's on the same page. You need to really encourage your staff not to be giving out false information, and we need to talk about it. If you hear something, let's talk about it as a group. Let's figure out if it's valid or if it's just part of social media or regular media putting out things that are not quite true. And the biggest one you got to deal with right now is, yes, the CDC has started some new guidelines with some caveats, but each state has to adopt them. And we're only in phase 1 of this new adoption. Hopefully, from what we're hearing, within 2 to 3 weeks, we should be in alignment with the new CDC recommendations. Okay? And that's very important. Post the rules, the common rules in your common area. Your letter, make sure that you send attachments or the rules with them. And you could send the CDC and the state guidance if you want. But whatever your families need to understand so that they're not making your life crazy by calling and filing complaints with everybody in God's green earth. And then keep your ombudsman in the know. The ombudsman may have some information that can be really helpful to you. So your relationship with the ombudsman is super important. So last but not least, I've been talking a lot about this for a long time, that the COVID notebook, after we got working on it, had 5 distinct parts. You're welcome to have more, you're welcome to have less, but this is what figured out would work, for the most of us. So your state directives should be on the bottom. Your policies and procedures for COVID-related information should be your next section. Staff meetings, training, the attendance sheets, and then a training guide. If you don't have one, I have developed one that you're welcome to look at. Resident meetings you're having. If you have a larger facility, what I've talked to a lot of facilities is, please don't do everybody at once. Make them more personal. So maybe do, if you have a hallway, maybe do those folks, or you have a group of rooms together. Kind of break it down into more huddly type thing, but make sure you're given the same information. And then tools and permission slips. If you have reactivated your family meetings, either on Zoom or in person, depending on what part of the state you're in, make sure you have captured those as well. And then your permission slips. So the big one now is changed up the testing requirement. If you go out, which is your right to go out, if you go to church or you go to a family event, go to the park, go shopping, whatever, you will be put back into the testing cycle. And all staff will continue to be tested on a weekly basis unless they're already experienced COVID and are in that timeout period for 90 days. Okay. Keep all of your screens and stuff in a locked drawer. I don't want anybody else to be a victim of what happened to a facility where all of the stuff the worker took and has literally but can't get it back at this point. Okay. So policy documents, I again gave a couple of they have on Google Drive some pretty cool stuff. And so there is some condensed version, and there's a checklist for small ALRs, and you're able to go get those and download them. And I take a yellow highlighter and go through the parts that are important to me. So is your staff kind of sick and tired of hearing you talk? Well, this is a reliable new free work toolkit for your staff. And the young people actually developed it. It seems to speak to them. So if you have some younger staff that you're having trouble getting retention of information and keeping their mask on correctly, washing their hands correctly, not contaminating different parts of the house, and not staying on task when they're doing meds and trying to fit something else in. This particular toolkit has some great information. So this might be a way for you to get it to sink in. For all of you that take this, make sure that you put on your own log that you took this. What I'm saying is take 2 hours, because time that you do the work that I'm asking you to do, look at the additional materials that we're asking you to do. It's good for 2-hour contact hours. And so you're welcome to put CGS, the slide deck, information on your log, and then you can have your own log of what you're doing to prepare yourself. So in all your meetings, any ALR meetings, any COVID meetings, any advanced directive meetings, the elder abuse program that we're doing, any of these, those are part of your training and to show that you are current in the industry. I plan to update in April, and it'll be available again to the administrative circle members. And so thanks for coming. I'm working on QMP reboot, and so we're taking QMP off the shelf. I heard a talk the other day that QMP is simple, not so much in my life. QMP is methodical and thoughtful, but it's doable. And once you have it in working for you, then I think it's fairly reasonable. But as far as being simple, that was hard for me to hear that. But I do believe we can catch up, that QMPs have been asked for in surveys. They're definitely being asked for in POCs, and they want to see more than the standard Chapter 7 requirements. So water temperatures, your monthly fire drills, your census sheets, your Mars QA. They want to see something more than the standard forms that's been used for some time. But don't forget to do those. So you may have not had a fire drill in a while, so you better get busy on your fire drills. And documentation of how long it takes to get everybody out and the results of them. So again, they want more than you just had a fire drill. They want to know that you're looking at it, reviewing it, and that your staff are not putting you under the bus. So thanks for coming today. We will, again, talk to you in couple of weeks or 3 weeks, and I'll do another COVID update probably in April. And then please pay attention to our social media website for all the trainings that we have on board and that we are putting on. And please join the ALR Administrative Circle. I love having you there and you being a part of CGS. Have a great day.